Welcome to The Explainer. We're diving straight into a massive puzzle today. And honestly, the stakes could not be higher. We're talking billions of dollars and millions of lives. We're going to look at exactly how healthcare delivery entities manage to sustain themselves while actually serving their communities. Specifically, we're zeroing in on a crucial, often overlooked piece of sustainability reporting: how these entities assess and discuss their strategy for managing their mix of patient insurance statuses to evaluate access for low-income populations. It is a totally fascinating look right under the hood of healthcare economics.
Which brings us to the absolute core tension of healthcare delivery. I mean, how on earth do hospitals balance their fundamental mission to heal people with the financial margin they literally need to survive? Because think about it, every single day, these providers face the immense pressure of giving high-quality care to anyone who walks through the door, totally regardless of their bank account. But, well, the lights still need to stay on, the doctors have to get paid, the facilities have to be maintained. This push and pull between providing universal care and, paying the bills, that is the central drama of healthcare management.
And right at the center of this balancing act is the core challenge: serving uninsured and low-income patients. According to the industry standards we're looking at, care delivery entities are constantly going to face challenges associated with these specific populations. This isn't just some temporary hurdle or a bad quarter. It is a permanent fixture of the global healthcare landscape. So how an entity actually navigates this tells us a ton about its overall sustainability, its long-term risk profile, and frankly, its operational ingenuity.
So to figure out how they actually pull this off, we need a solid framework. Enter the official SASB industry standard for healthcare delivery. These standards, which by the way are now under the stewardship of the International Sustainability Standards Board, give us a highly specific, standardized set of metrics. Companies use these to report on their sustainability-related risks and opportunities. And investors and analysts? They care deeply about these metrics because they expose hidden operational vulnerabilities. We're not just guessing here. We're looking at the exact guidelines hospitals use to report this financial and social balancing act to the rest of the world.
Let's actually look at the specific metric and see how this works. It's SASB metric HCDKY 240A.1, and it requires entities to provide a, quote, discussion of strategy to manage the mix of patient insurance status. That right there, that is the golden key. It forces healthcare providers to drop the vague PR speak and articulate exactly how they plan to manage the financial realities of treating patients who all have completely different ways of paying for their care. It is all about the strategy behind the mix.
Okay, so what does this patient mix actually look like out in the wild? Well, a healthcare facility's patient base can generally be sliced into three crucial categories according to the standards. First up, you've got patients with private insurance. Second, you have patients with government-sponsored insurance. And third, you have folks who are completely uninsured. Every single hospital has to meticulously manage the proportions of these three slices. Their entire financial health completely depends on how well they balance the revenue that's generated, or, not generated, by each of these patient groups.
Now, why does this specific disclosure matter so much to an analyst? Well, it isn't just about charity or good vibes. It is fundamentally about financial viability. The SASB standard points out something really interesting. Healthcare entities that develop innovative pricing structures can actually profit from increased private insurance enrollment, and they can expand their overall patient base. It proves that managing the needs of low-income patients with smart pricing isn't just a sunk cost. When it's done right, it can actually have a positive effect on revenue. It's this rare space where doing the right thing and practicing smart business actually align perfectly.
To pull this off, hospitals use what the standards call alternative pricing mechanisms. Think of these as the specific tools in a hospital's financial toolkit to manage those uninsured populations while trying to offset their costs. The main ones listed are discounted or sliding fee schedules that are based on a patient's income, care that is given strictly for charity, and discounts offered for prompt payment. But listen, these aren't just boring bullet points on a balance sheet. They have massive real-world implications. Let's look at how a couple of these actually play out on the ground. First up, we have charity care. The standard defines this pretty directly. It's care given as a financial write-off for the entity. Imagine a patient comes in needing an emergency appendectomy, and they literally do not have a dollar to their name. This is the safety net that catches them. They get the life-saving treatment they need, and the hospital just absorbs the cost by formally writing it off their books. Obviously, it's a completely critical resource for the community, but from a sustainability reporting standpoint, the hospital has to actively account for and manage the sheer volume of these write-offs so it doesn't completely sink their operating budget. Moving on, we've got prompt payment discounts.
Now, this sounds super simple, right? But the strategy behind offering discounts to uninsured patients who pay quickly is incredibly pragmatic. Actually, collecting medical debt from uninsured patients is notoriously difficult. It takes forever, and it's super expensive. By offering a discount if they just pay immediately, the provider manages their financial risk, they ensure a predictable influx of cash flow, and they cut way down on the heavy administrative burden of chasing those payments. It is a highly calculated strategy to stabilize the revenue side of that uninsured patient slice we talked about earlier.
Now, to really grasp a hospital's strategy, we have to look at the specific programs they actually participate in. The SASB standards set up a really crucial comparison here between two safety net programs that probably sound identical to the average person, but financial analysts assess them entirely differently. Those two are financial assistance programs versus indigent care programs. So why would an analyst care which one a hospital uses? Let's unravel that.
We'll start with financial assistance programs. According to the text, these are typically administered directly by the hospitals themselves. They're built to provide no-cost or discounted care, specifically for patients who can actively demonstrate they just cannot pay for the services. The really key takeaway here is the locus of control. The hospital is the one creating the policy, managing the program, and directly absorbing that financial impact entirely internally on its own balance sheet. Contrast that with indigent care programs. While they also provide financial discounts for patients who can't pay, the standard explicitly notes that these are typically administered by jurisdictions. So we're talking state, local, or regional governments. This completely changes how a healthcare entity interacts with the funding. They are participating in an external government-run framework rather than just self-funding the discounts. Understanding the balance a hospital strikes here is absolutely critical. I mean, think about it. If a local government cuts that funding tomorrow, an analyst really needs to know how exposed the hospital actually is.
Ultimately, what the SASB standards reveal is that this isn't just dry accounting. It is all about adaptability. Looking at the disclosure on how entities manage care for uninsured populations lets users fully grasp the associated risks and opportunities. If a hospital is sitting in a neighborhood with a rapidly rising uninsured population, how are they adapting? Are they getting innovative with sliding scales? Are they totally maximizing their indigent care partnerships? This single metric reveals the resilience, the social impact, and the financial sustainability of a healthcare provider, all at exactly the same time.
As we wrap up today, I want to leave you with a thought to chew on the next time you see a headline about healthcare costs or hospital sustainability. Look right past those massive top-line revenue numbers and ask yourself, is a healthcare entity's pricing strategy truly expanding access for those who need it most? Or is it really just shifting the financial burden around? The answer, as we've seen, is buried right there in the details of their patient insurance mix disclosures. Thanks for joining me on this deep dive. Keep asking those hard questions, and I'll catch you in the next explainer.